Thank you, Todd. A reminder that if you ordered Rotary gear, you can pick that up after the meeting. There will be a table set up as you are leaving downstairs today. Now, let's talk about last night. Last night, a group of Rotarians decided to trade service for strikes at the bowling alley at an event that our membership engagement committee put together. Let's just say, if Bowling Skills were a fundraiser, we would have a lot of donations to collect. I did see someone bowl a strike, but only after the ball bounced off the other lane. Somehow it became a strike. So thank you to everybody that came out last night. It was a fun time had by all, as you can see from this picture here. And now I invite Chair of the Student Education Committee, Debbie Ashway, to the podium to share with you an announcement.
I am so excited to let you know that applications for the 2025 York Rotary Scholarships are now open. We have $48,000 available through our 11 named scholarships. They're for graduating high school seniors, current college students, and adult learners. So what is new for 2025? First of all, the York City Student Success for Tomorrow Scholarship. And their criteria is for graduating York City high school seniors, academic achievement and financial need, and the award is for $2,500 a year, so up to $10,000 total, and we're giving 2 of those out. The other new thing with student education, we have the York Rotary Adult Learner Scholarship. This is a new name for what had been non-traditional. The Non-Traditional Student Scholarship Fund and the Bert Oberdick Non-Traditional Student Scholarship Fund. So why did we change the name? Because we wanted to better align with language commonly used by colleges to describe these students. So the criteria for adult learner is it's a York County non-traditional higher education adult learners who do not enter post-secondary education immediately following high school. They have to be at least 26 years old or a veteran age 24 or older. Attend an accredited institution or an accredited program of learning or training at least part-time during the year. They have to pursue their first bachelor's or associate's degree, trade or technical school or professional certificate program. They have to be a resident of York County for a minimum of 3 years. And the scholarship is preference to residents of York City. The award is 1 scholarship, $2,250, and we have 2 of those scholarships available. So how to apply? So on our website, you click on our impact, and there's a drop-down box that will show you York Rotary scholarships. And it shows, it's not showing here, but when you go to the website, the drop-down box, it'll show all of our named scholarships and give you a description and the criteria for all of them, including our new ones. So all you do is click the box says apply here, and it goes directly to TFEC, T-F-E-C, which is the Foundation for Enhancing Communities. They are our scholarship administrator. And then at the bottom, it says criteria. You click at the bottom and it brings you to the awards. The deadline is March 15th to apply. So how can you all help? Spread the word, especially to the adult learners. Traditionally, that's been an area that we've gotten low applications. So we really need help with that. On all of your tables, there's a flyer that we've created and has a QR code. And it's so easy. When you use the QR code, it brings you directly to our website, and it's so easy. Also, check our Facebook, because there's going to be a video and TikTok that you can share. And you should also be able to share the flyers. We're going to make that available to you as well. So spread the word. We've got money to give.
Exciting times. We got on the TikTok right before they're shutting it down. All right. Thank you, Debbie. And now I invite past president and chair of the nominating committee, Dave Meckley, to the podium to give us a committee spotlight. And as Dave's making his way up, I want to give you a reminder on what a committee spotlight is. The purpose of doing one of these is so that a committee can share awareness of what it is that they do, as well as share how their committee ties into our club's mission statement and strategic plan. So Dave, take it away.
Thank you, Courtney. About 3 years ago, some changes were made to the nominating committee in the process for nominating board members and officers. The nominating committee has 9 members with at least 1 past president, 1 current officer, and 1 board member. Committee members have staggered terms with the potential to serve 2 3-year terms. Each year, current president, president-elect, executive director meet to review the current board members, look for future needs of the club and how it aligns with the strategic plan, and look for qualifications and characteristics that are important for new directors and officers. Examples might include specific professional skills or underrepresented parts of our club membership. The committee then meets with executive director to identify potential candidates for the board and open officer positions that can fill the targeted qualifications and characteristics. The committee reports back then to the board and obtains approval for the final candidates. And finally, you, the club membership, votes on the proposed slate. Nominating committee work has begun for this year. You can help with passing along suggestions for new board members and officers. Members of the committee include Doug Berman, Glenn Miller, Joyce Santiago, Brian Tate, Jules Tolbert, Cal Weary, Sarah White, and Phil Woods. We really do have a proud tradition of capable and dedicated board members and leadership. I'm confident our nominating committee will continue that tradition with excellent candidates again this year. If you have any suggestions for the nominating committee, please contact one of the members or me, and we'll put that into the system. And thank you for your help.
Thank you, past President Dave. And I must say, I prefer listening to you when you're wearing that sparkly Christmas light up headband. Really grabbed my attention a little bit more. No, just kidding. All right. And now I would like to invite past President Mike Summers to the podium, who is going to introduce our speaker for today. Mike.
Thank you, President Courtney. Our speaker today is Shawn Lovelady, the Chief Executive Officer of OSS Health, a physician-owned and operated orthopedic health system serving York, Adams, and Cumberland counties. And Shawn has over 25 years of strategic leadership in hospital operations and ambulatory care with a passion for innovation and digital transformation. A native of Texas, he most recently served as the President and Chief Executive Officer of Methodist McKinney Hospital in McKinney, Texas, where he oversaw a dynamic healthcare network, including an acute 23-bed surgical hospital, an off-site ambulatory surgical center, and a 22 outpatient physical therapy clinic. Shawn earned his Bachelor's of Business Administration and Master's of Science in Accounting from Mays Business School, Texas A&M University. He has served on numerous boards over the years, including the Ferguson Road Initiative, the Texas Hospital Association, and the Greater East Dallas Chamber of Commerce. Shawn looks forward to the opportunity to now serve in New York and surrounding communities. As CEO of OSS Health, Shawn will lead the operations at the OSS Orthopedic Hospital, the Ambulatory Surgical Center, and various clinics located across central Pennsylvania. Shawn looks forward to supporting the organization by identifying areas of growth, strategizing how to best overcome ongoing healthcare challenges, and continually finding ways to be the best orthopedic provider and community partner possible. Fellow Rotarians and guests, please warmly welcome Shawn Lovelady.
Good afternoon, everyone. It's a pleasure to be here this afternoon. Thank you for inviting me to speak with you guys about OSS Health and the journey. I think for me, being here in the community for 10 months, I hope I don't do it a disservice. There's a lot to learn from a history perspective. I see Vicki Diamond in the back. We've had the opportunity. I know she was speaking with you in November, but really healthcare is a tight-knit community, and regardless of what happens, and even if we're competitors with the spirit of helping take care of those families and people that we serve. So, Courtney, I don't know if there's a clicker somewhere. So, thank you. But while we're waiting on that, a great 10 months here for me came in. We go. I think we talked about ad-libbing, so I can do that. It's been a great 10 months for me. I think what I'd like to try to share with you today is really. Is it still there? Hey, it's not personal. You just go with the flow. So I will try to speak up. Can people hear me? At least I'll try to keep going. So on the outside looking in, I think this is interesting and really want to be able to share with you. I think for a number of you, you may look at it as a physician practice, and that's really what it started out to be. You obviously had three groups with, Batera, Moritz, and Hoffman, and KDV orthopedics really coming together. And then you had Moritz, Pollock, and Rotary Associates coming in at that point. Really the three main groups that formed OSS back in the early 2000s. And those practices obviously has continued to grow and change. A number of those individuals, thank you. A number of those, yeah, there we go. There we go. So a number of those partners obviously have retired over a period of time. We still obviously have Dr. Rudder with us, and it's a continuing evolution. So can we go to the next slide? So how far have we evolved? And I think this is important for you as community members and business leaders. We opened our Powder Mill campus in 2005. We opened our OSS hospital in 2010, and the inflection point was us changing into a health system of a provider-based system in 2012. So everything is run through our hospital, right? Whether it's our physician practices, it's our physical therapy, DME, all those particular things. We truly are an integrated delivery network around musculoskeletal services, whether it's the urgent care, through the surgery, through the follow-up and physical therapy and DME. We have that to be able to coordinate for you. We opened our OSS Foot and Ankle Clinic in 2015. We opened our West York campus in 2019. And again, just some of the milestones that we've hit over the period of time as we've continued to evolve. But it comes with a collaborative business effort across all of our functions. We truly focus on that patient care win every single day and trying to provide the best care for those families. And as I would always say, great teams continue to evolve, right? They continue to look inward. What are we doing well? What can we do better for our community? And how do we get there? Next slide. So today, we're obviously a very strong independent physician-owned delivery network, right? You look at the 9 locations, we span the majority in York, but all the way over to the corner of Adams County, where we've got our Hanover and Gettysburg location, and then back up in the West Shore market of Cumberland with our Enola, Good Hope location and our Mechanicsburg location. Next slide. A little bit about our providers. We've got over 91 providers. We've got 23 partners that span our orthopedic surgeons and physiatrists. But regardless of whether it's surgeons, anesthesia, to emergency medicine, medical side, these are the people that help lead us every single day as a physician-owned organization. Next slide. Just a little bit about our services. And I know I talked a little bit about the integrated delivery network approach, but whether it's urgent care for those needs that you have, to our sports medicine, physical therapy, imaging and MRI, to our outpatient and inpatient surgery. Again, those are the main services. And next slide. To our spine center, our general orthopedic care that's in our clinics, our pain management, podiatry, and surgical hospital. So I would say for us, we're extremely proud to have that ability to, again, take care of those families from start to finish. Okay, thank you, sir. A few others. We've focused on bone health clinic. We've also looked at our company direct program. So I know there are leaders in the audience that have their own businesses. And one of the challenges that we'll talk about in a minute is really about healthcare cost. It doesn't matter whether it's WellSpan, UPMC, it's OSS Health. Healthcare costs are rising rapidly. You have to make difficult decisions with your employees around how to take care of their care, regardless of whether it's medical, surgical, oncologic, those types of things. And so are there opportunities where we can carve out value-based arrangements to support those costs, sharing that risk together? And that's one of the things that we've started with our company direct program. We have over 40 companies that we work with. We're continuing to expand in that area. We have a sports medicine primary care physician who leads our female athlete clinic. And then we've got quite a bit of workers' compensation programs that we support across South Central Pennsylvania. So recruiting and retaining people, this is very big for all of us. For me, come from Dallas, 8.5 million people. It's a lot of opportunity to recruit. But we have amazing people in South Central Pennsylvania. We have amazing people that we get from the state of Pennsylvania and even in the Northeast. And so when you look at us, and one of the things that I think was important for me, when you look back at 2013, our organization has doubled in size from 2013 to 2023 at the end of 2023. We were an $83 million organization at the end of 2013. At the end of 2023, we were $161 million. And at the end of 2024, we're closing in on about $175 to $180 million organization. At that time, you can imagine that the number of people to support the organization has obviously grown. We have 817 FTEs. Obviously, that's broken down around 345 clinical support, over 240 non-clinical support, 139 nurses. And I know Vicki had talked a little bit about partnership with York College and obviously nursing, because that's extremely important of continuing to recruit nurses and highly specialized people. And obviously, we couldn't do it without our 91 providers. So a little bit of breakdown about how, again, trying to find those right avenues to recruit and retain our people. So investment in York County, and it's important because it's the Rotary Club of York, but also in South Central Pennsylvania. We have put down our roots here, obviously with our Powder Mill campus. We've got our West York campus of continuing to invest from an economic perspective. We're continuing to look at other opportunities around the area. And what I would say is that, we're making those investments because it's not only just OSS Health, it's a partnership. And one of the things that I always look at from a leadership perspective is how do we find the right business partners? How do we find the right collaborative partners to help us in this particular market? which kind of leads into the next slide. What are our challenges? And it doesn't matter whether it's OSS Health or any other healthcare out there. We've got reimbursement model challenges, right? You hear it consistently of how do we continue to fund Medicare on an ongoing basis. Our operating costs have risen significantly since COVID, and we've got to be able to try to manage that, find innovative ways. A lot of our employees will sometimes ask, well, what about AI? Is AI going to take out my job? No, I don't think AI is going to take out your job. I think AI is going to augment how we do our job and how we support and put those tools into place to support our employees. We don't know what's going to happen in about 5 days around with tariffs. We hear it on the news. But if tariffs are put into place, what does that mean to us in terms of managing the cost of the organization, and how we continue to procure those supplies, whether they're from overseas, are they from United States manufacturers? We have to figure that out, and it will be a dramatic impact to us if those do go into place. Again, the moving of the economic and political pressures, regardless of political views, we have to find the right way to take care of our patients, regardless of being in a full system or in an integrated delivery network like ours. And then lastly, just how do we continue to recruit and retain staff that we need? Yeah. We're stuck again. All right. So looking ahead for us, I think this is where I would like to spend more time, and then obviously question and answer. Happy to take those from you. We're a proud physician-owned integrated delivery network, and we will stay that way. I can tell you over and over again, our physicians do not want to be bought out by private equity. It's a constant conversation. They've watched what's happened with private equity, and if you're in the room, private equity, I'm not trying to offend you. It's just they have that viewpoint, and they're very strong about who they are. But how do we get there? How do we balance those funding requirements of continued to grow? How do we evolve, right? I want to go back to the first slide. They're physicians. They owned a physician practice. As they start to grow and have evolved to become a health system, that is a different challenge. And if you haven't led that, it comes with change management, helping physicians understand that you're not trying to take away something that they've put their time, effort, and energy into, but being a collaborative partner with them, finding the right resources to help them feel like they're still leading the organization, having input on how that organization continues to evolve. So again, finding our right amount of funding and what that means to us moving forward. But we are in a growth mindset. I would tell you over the last 10 months, we've really reformulated back to our basics of being operationally sound, so that we can move forward in 2025 with our growth. We're looking to finish our ambulatory surgery center and our physical therapy center up in the West Shore market at our Enola building. We're looking at expanding our clinics in Hanover and Gettysburg. And then we will analyze new markets as we move forward. But as I've told our employees and our team, we're going to focus on our core markets. Sometimes you overstretch yourself too far, and you've lost your operational mindset and how you got there. So let's focus on what we do well. Let's invest in the markets that we're already in. And then once we've been sound and operating in those, then where else do we go? So again, a quick presentation. I really wanted to spend more time taking question and answers from you guys. So I'll turn that over to questions from you. Okay.
If you have a question, come on up and we'll just share the microphone. You can just form a line right here. Anybody that has a question, get those steps in for the day. It's a little different than normal. Come on up. Don't be shy. I'll lead us off with the first question.
And by the way, I drove by the crane today. It looks great. So
there you go.
It's a very big prank.
So you had talked about, I guess there was a company, you talked about it at the beginning of your presentation, where employers were able to somehow have a partnership with OSS when we're looking at rising healthcare costs. Can you talk a little bit more about that program, what that looks like for you to offer to individual corporations to get involved?
So obviously I'll give an example here. And I'll use the Kinsley Enterprises. Obviously, we have a relationship with them. And when you look at the Company Direct program, let's just say that on an annual basis, perhaps they're spending $2 million. And again, these are not their numbers. I'm just using rough numbers. Perhaps they're spending $2 million a year in healthcare cost. When they dive down into it from an actuarial perspective, perhaps they've spent over $750,000 on orthopedic and musculoskeletal care. How do we go back to a Blue Cross Blue Shield, whether it's Capital Blue Cross, Highmark, maybe it's at United, and look at that as a particular carve out where actually the risk comes back to us as OSS to take care of those patients, right? So if for example, they go through care, they see a physician, they need a joint replacement. And in the market, the joint replacement could cost you $40,000. For us, it could be a lot less if we package that from a value-based perspective. So what we've tried to do is be able to go back in, talk about what that delivery network program looks like, look at what the costs are for those businesses that we could actually partner with, and figure out a way to actually reduce their healthcare costs for their organization. So that's kind of just a little bit about it. I mean, there's obviously that more that goes into it, but it's really kind of an adjunct to your current payer relationships and being able to partner with them. And so we have to do a better job of getting to those payers, making sure that they don't think that we're actually a competitor to them, but we're actually a partner with them along the way in the Company Direct program.
Hello, thank you. Wanted to know more about your considerations for discontinuing the internal primary care services that at OSS, and how does primary care fit into your system of delivery of service?
So 10 months in, I'll try to do my best of answering it. I think primary care is actually an integral part. I would say on behalf of OSS, didn't have the depth and breadth that we needed to. Not being here when they made that decision, I think they tried to make the best decision that they could and figure out how they would continue to partner with primary care and internal medicine physicians in the community. Obviously, we have our regional partners with, WellSpan and UPMC, and they have a very large group of primary care. Again, I think I don't want to keep calling out Vicky, but we've had some conversations where, you are competitors, but you also have to be partners in some form of fashion, and understand what you do well, and stick to doing what you do well. Because if you spread too far, then to me, you're really doing the patient a disservice.
Thank you. Do you recognize or can identify specific increasing regulation in the healthcare industries that is hurting everybody? I mean, us as consumers and you as a provider. Because I don't really know what all the regulations are, but I hear regulation, and I sense that you're probably under scrutiny like everybody else is.
It's a good question, Jim. It's constantly evolving. I know that obviously the General Assembly is in-house now, and obviously they, and you think about the from a hospital association of Pennsylvania, they haven't touched those regulations. So specifically to the state, they haven't touched those regulations in about 40 years, and they're actively looking at it. I'll give you an example. One of the key points that would be potentially harmful to OSS Health is 24/7 surgical coverage. If they put that into place, we're not doing surgery at midnight, right? And we won't have those resources to be able to do that. And that would be detrimental to an OSS Health. But more importantly, I'm going to go far past that. Think about the critical access hospitals that would be impacted by that, having to have 24/7 coverage when they're struggling just to make ends meet, right? Every penny in the door for them is impactful to how they stay open from a remote community perspective. So I think there are regulations across the board that we have to align with our partners in the community to figure out like what's the right regulation, right? There are minor things that have to happen that are really for the health and safety. Give you an example is cautery, right? And the smoke removal of cautery, if you're standing over a table for 3 hours a day, there is some thought process that the smoke from cautery could prove harmful to the staff that are doing the surgery, right? So are those things, impactful? Yes. Are they costing additional dollars to put into place? Yes. But those are just some examples that from a regulatory perspective, there are things that are going to change every day. There's things that we're going to win on. There's things that we're not going to win on. But I don't know if that gives you some examples of, challenges or concerns that are out there.
Hey, first off, thank you so much for the presentation. It was great, and I certainly love learning more about how we're improving healthcare in the region. And my question is, I think we all understand that healthcare is super complicated at the moment, and there's the actual getting healthcare and procuring healthcare and then paying for it. And oftentimes when it comes to the price of healthcare, the lowest possible price doesn't correlate with the best possible outcome. And excuse me, I know one of the goals for the next 2 to 3 years is innovation. And I was curious what types of innovation OSS is looking at to ensure the best possible outcomes for their patients.
It's a good question. I think for us as an organization, and I try to, being smaller, are there innovations, as mentioned earlier, is there AI innovation, right? Is there an opportunity to remove issues with coding and billing, right? Because if you think about it, a bill that gets coded wrong, information that goes to a payer that gets denied, creates an issue for you as a patient, right? And then it comes back and then you're struggling to get a bill paid, you get something to your home and you become frustrated as a consumer. So I think there is some form of artificial intelligence that can be put in to our daily workflows that can help us. From a robotic perspective, when we look at surgery, while there are costs to that, there are improvements from outcomes. Is there safety and an increase of having less anesthesia, right? Somebody having a quicker surgery. But I admire you for saying that because the lowest cost doesn't win the game and is not always the right quality outcome, because I think it's important that we balance those costs. So, when you look at technology, I think including technology across how we engage with patients. I think for a long time, specifically speaking about OSS, they've done a lot of great things, but they've also done a lot of things where, I think we can move ourselves into the 21st century in terms of taking care of patients. And then, I think the last piece is really thinking about how we partner with the payers, right? If the money flow is coming through not only us from being self-insured, but back to a payer, is there an opportunity to say, hey guys, let's look at this a little bit differently? Are there tools and technologies? Because it doesn't matter whether it's the Blue Crosses or the Uniteds of the world, they're buying up everything from a vertical perspective, right? So are there ways to go back to them and say, look, we're going to use these technologies. We'd like to partner in this particular way Will you help us reimburse for those particular pieces? Because it's great to have tools, but if the tool doesn't help create a quality outcome, or if it's more costly and you're not going to be able to help pay for that, then there has to be a different way from a reimbursement model to get their time and attention to help partner with us. Because it is a struggle every day, right? And we see those struggles. Yet from a political perspective and also from a media perspective, what you see is a United Healthcare or someone else making $5 billion, $4 billion, and that becomes really problematic, as we've seen with some of the challenges around misinformation, right? So, yeah.
Hi, how do you handle situations that approach the boundaries of OSS's expertise, particularly with respect to cancers, whether it's multiple myeloma in the bone marrow or some other? First of all, from the point of view of the patient, but also from the point of view of dealing with other providers and payers. And how does that then roll into impacting a company if they're working with you through company direct?
So for us, we could only be able to cover, right, that particular cost that's related to the musculoskeletal care. We have relationships, again, with whether it's UPMC, WellSpan, Penn State. Our providers have those relationships and privileges where you can actually connect with other specialists to send those patients along in their particular journey, consult on the other medical and surgical needs that are there. Cost-wise, we'll have to sit down from a payer perspective and with those systems, because today we don't share those costs. I think we would have to get to some type of larger value-based relationships where those organizations are aligned with us, looking at the actuarial data. How many times does that come up? And is there a way to potentially reduce those costs if people come in from not only from an orthopedic perspective, but then have an oncologic or orthopedic issue that does come up. Yeah.
One more question from the online audience. Please explain your philanthropic focus areas in the York area.
You just hit on something that, as I look, I know Brandy and Lisa are here with us today. It's something that I've brought up to our partners as we continue to grow. And yes, we're a for-profit organization. We have to give back to the community. We are currently involved with United Way and spending quite a bit of our time and money with United Way, but it has to expand outside of that. Rotary Club of York, right? And I say that because I am being truthful. When I look at the organization, I think one of the things that they have to do is get back into the philanthropic side of it. We've had a large turnover in our physician partners. Again, going back to Patera, Moritz, KDV, Rudder and Associates, and more, there's only one or two of those left, right? So as our new docs come in, we have to, even though they might have grown up here, and a lot of them have, they have to get back into that side of philanthropic giving and being a part of the community and giving service and time. So I will speak for myself that as CEO, that's something that I want them to be able to do, and I will continue to drive it in our meetings. As my team knows, I always fact check, inspect your own expectations. And if that's my expectation, that's what I expect of them as well.
Thank you very much, Shawn, for sharing OSS Health's vision for advancing orthopedic care in our region. Your plans for growth and your commitment to our community are inspiring, especially your commitment to the Rotary Club of York, which you all heard him say. So thank you for your leadership and taking time to speak with us today, Rotarians. Let's give Shawn another round of applause. As you all know, instead of giving the speakers a gift, we purchase a book and we ask them to sign the book plate and we donate that book locally. This week's book will be donated to York Academy Regional Charter School in York City, along with a bookmark made by the students at Creative York. Next week, our speakers will be Patrick Bell, interim CEO of Life Path Christian Ministries, and Robin Shear, executive director of Friends and Neighbors of Pennsylvania, and they will discuss the state of homelessness in York. This meeting is now adjourned.